Hello.
Hello, Miss Adams.
How are you?
I'm happy today, thank you. It's still not, now it's still a good time?
Yes, no, it's good. It's good. Sorry. Oh my gosh, this meeting ran and then all the clocks in this place said it was an hour later. I'm like, oh my gosh, have I been here for 2 hours? So then I'm like texting you and then I'm like, oh no, I didn't miss the meeting. They just didn't ever fix their clocks. Oh my God.
But it seemed like 2 hours though, didn't it?
Unfortunately, the meeting I was just at did seem like 2
Yeah.
hours.
I've been in those. I know how you feel. I'm so sorry.
Oh my goodness. Yeah, I'm like, wow, thank goodness it wasn't 2 hours of my life. It was only an hour and 45 minutes.
It just felt that way.
Yes.
Wow.
Yes.
Well, I appreciate your time today. I really do.
No, of course.
And I'm recording it right now on my Zoom account. So we'll have this, it'll only be 30 minutes or maximum, but I try to keep that short so you don't take up all your time. So,
Okay.
so real quick, you've been doing what you've been doing. Your occupation is what again, and how long you've been doing it?
Okay, so Leslie Andrews, registered nurse and certified diabetes care and education specialist, and I've been at St. Vincent for close to 15 years.
Fantastic. Wow.
Yeah, I know.
Wow. For being there that long, you have to love it.
Yeah, I do. I do.
That's fantastic. So when you were choosing your profession way back when you were in high school or even in grade school, what do you want to be and why'd you decide to be the nurse?
Yeah, so initially I didn't know, and then I went to college and thought I was going to be some type of business something. That lasted a year.
Okay.
And I transferred from my first college to another college to go into nursing. And really because in high school, I did have a job in a nursing home, in dietary actually. And then that first year of college, got a job as like a nursing assistant at a nursing home and kind of just loved it and thought, what am I doing? I don't want to do business. This is not for me. So transferred and got into a nursing program. And
fantastic.
there you have it.
Where'd you grow up at?
I grew up in North Royalton.
Oh, fantastic.
Currently live in Lakewood. So.
By York Road or by Royalton Road or by where?
So I was right off Wallings.
Okay, got it.
Right in between Ridge and State.
Got it. Okay. Fantastic.
Yeah, so you're familiar with the area.
Yeah, I grew up in Kirtland, which is a little town east of Cleveland.
Okay.
But we used to go. My dad used to have. It was really funny. He used to buy these entertainment books way back when, where they would you have coupons and you buy one get one free. So we had to try to find this one pizza place in North Royalton, Ohio. And my dad got mixed up with North Ridgeville and got mixed up with North Homestead. So this is before you had MapQuest. So you had the fold up map in the car, and he was so upset. He kept folding the map and unfolding it and throwing it and getting mad. And we finally ate pizza at someplace close. I mean, it wasn't even the one. So,
oh my gosh, that's so funny. You were probably trying to get to Angie's probably, or like one of those.
This was back in the 70s. So yeah, it was like right after Christmas time. And it's like, it was supposed to be a father-son thing. And it turned out to be a really big, I felt bad for my dad because he really wanted to do it. He wanted to save money. He spent like more money on gas than he did on anything else.
Yes, right. But you do remember it, so.
Yes, I have. That's my memory of North Royalton. I know it was on York Road. I remember that we were trying to find York Road.
So funny. Oh my gosh.
So tell me this: when the pandemic first started, how did St. Vincent, in the hospital itself, how do they handle it? And then what did you see over the period of the next 10 months or so?
Yeah, I mean, for us, of course, everything sort of shut down, which was sad for many of our patients with diabetes, because they were coming for visits. We have a vibrant diabetes support group that was meeting 6 times a year. Support groups in its 8th year, actually. So that was really difficult because folks were really, scared, struggling. There were lots of unknowns. Folks didn't want to come in for their appointments because they were scared. They did still want to have support group in some fashion because that was their support network. There were lots of folks who had made really, really good friends through that group and really looked forward to seeing each other every other month. So you know, through that first year, we kind of worked to still meet virtually, which was a bit of a challenge because many of our folks either didn't have computers, didn't have smartphones, things like that. So that kind of progressed. We actually hooked up with PC for Peoples, got some of our participants free computers, kind of told them about internet access that was very reduced in price. Lots of them were still just calling in by phone, but it was a way for them to still connect with each other, at least over the phone or through, we were having Zoom meetings, and it has been wonderful. I mean, we started, it was a little slow and we didn't have a lot of people who were attending, but we've had a decent turnout, and we've been doing them monthly because we want folks to still feel connected to everyone. So we went from, you know, doing every other month to every third month in person to really every month doing a virtual meeting. And it has been super, super helpful for folks. And they've, you know, been so excited that we continued it and that they can still talk to each other and see each other and still get that support from us and from the other members of their community.
What's your average age in the group?
I'm sorry?
The average age of the group?
We run the gamut from probably late 40s to 90s. Okay.
Did you see any issues of A1C increasing like crazy in the first 6 to 10 months?
Yeah, I would say saw a lot of anecdotal data like that from our interactions across the street at Skyline Tower. It's a senior living complex.
Okay.
And we ended up, you know, we used to be there on a monthly basis. We were not able to go there at all for, gosh, it was probably almost a year. When we ended up going back, I mean, the first couple times it was overwhelming.
Tell me why.
Folks' blood pressures were out of control. Sugars were extremely high. I know we sent 1 or 2 folks to the ER the first couple times that we were there. They hadn't been to the doctor. You know, we weren't coming, we weren't doing the checks. They didn't know where they were in relation to their diabetes and blood pressure. So that was overwhelming. We, thank goodness, are now able to go back every month so that, you know, we're getting back into a rhythm with that group, and, you know, they're able to come down and get checked. But initially those first couple times were, it was crazy. I'm like, oh my gosh, I feel so bad we haven't been here because this is way out of control.
How many people in that group, in that building? How many people do you have in your group?
So that building has around, I believe, 150 to 200 people who live there. And we see anywhere from 20 to 30 every time we go.
Okay. So from March, let's say, until when, September, when you first got back, or when you first get back there?
We did not end up getting back till, when did we end up going? It might have been, the 2000, the spring, I think it was in the spring we ended up getting back.
Of 21?
Yeah, maybe we ended up, were we there last summer? I'd have to look at my notes and see when we ended up getting back there, because I know we weren't there when 2020 hit. So that was pretty much all of 2020. Okay. So probably early 21, we ended up getting back because things had gotten a little better. We were able to get back probably in February or March. And then we were also doing some stuff outside in the spring and the summer. So it wasn't, you know, they were okay with having us come back.
When you saw them, how were they, and what was their first reaction when you tested them? And the ones who were fine, and the ones versus the ones who weren't fine?
Yeah, definitely surprised. I mean, some of them hadn't been to see the doc. I mean, they were still taking their medicine, but, you know, life was stressful. They were, you know, lots of them couldn't get out as much, you know, their daily routines had changed dramatically. And a lot of them were under a lot of stress due to this pandemic. So I think that contributed to it. some of them, did not know that it was that high. I mean, with the blood sugars, some of them had an idea because they were testing at home, but the blood pressures definitely were something that they weren't aware was getting a little out of control, and a lot was because they hadn't been to the doctor.
Yeah.
Whereas they were going every 3 months, and then it had been 6+ months they hadn't seen anyone. So we definitely encouraged them to get back, that things were safe to go to the doctor, that they could go to see their physician. So
Did you lose it?
just
Did you lose it?
encouraging.
Did you lose anybody during that time? I mean, like they passed away?
There were, it actually had, unfortunately, just recently, there was around Christmas, quite a few folks over there who had passed away. Not many, thank goodness,
That's good.
during the COVID period. A couple, but yeah, there wasn't, like frequently hearing of that, although folks knew of people who had passed away, not in their building for sure, which also, was very difficult. Or they knew family members who had COVID and were in the hospital, and they couldn't go see them. And, that was another difficult thing. And then the vaccines were another hesitancy, especially, we actually did a whole support group on the vaccine, and had a pharmacist come and answer lots of questions about hesitancy and how was the vaccine made and is it safe? And there were lots of folks who hadn't gotten the vaccine yet. And this was, early, when it wasn't really, available, January, February is when kind of it started to become more available. But folks were nervous. They weren't sure. So it was good. I mean, that support group really, I think, eased some of their minds. They didn't all get vaccinated, but I think it helped move those who were on the fence in the right direction.
Will they be considered, the people that you work with, the diabetes people that you work with, will they be considered an at-risk group with the whole COVID infection?
Definitely. Yes. And we tried to stress that, having diabetes just puts you at such higher risk of complications from COVID. Your age already puts you at risk, but then having diabetes, most of them have hypertension. They have all those risk factors that make COVID very dangerous.
So it's amazing, though, that given all that information, that they're an at-risk group, that in that first, between March till, let's say, the end of December of 20, that you didn't lose that many people, if at all.
No, we didn't.
That's a tribute to you
great.
guys. Yeah.
Yeah, thank you. Yeah.
Truly, I mean, you have an at-risk group, a lot of them, and your efforts before the pandemic and during it and after, or not after, we haven't got it through yet. But,
not there yet, but right.
But your efforts have paid off because you didn't lose anybody.
It has. They've been, they have stayed very, very healthy. We facilitated getting some of them the vaccine. It was also a struggle for them to, even if they wanted the vaccine, to get the vaccine, because a lot of them didn't have computers to sign up, and most of it was through a computer that you had to log on. So we tried to facilitate that as much as possible. There were some, community resources that were providing some codes that we could go on and schedule folks, provide rides to the vaccine for them. We did some vaccinations here at St. Vincent, so we were able to get some of our patients in here, which was wonderful. Just trying to help them as much as possible. And then we worked a lot on getting personal protective equipment out into the community. That was a big push. Worked with a lot of community organizations where we could get it to them, and then they were distributing it. We were out in the community distributing it. We were able to get some resources from the Ohio Department of Health. Community Connections was also providing like personal hygiene items along with masks. So we were able to make some kits and get them out into the community. just really trying to get folks what they needed,
You know,
mask wise.
what it shows me, I mean, sometimes the lack of something happening is a very positive thing. And so what it shows me by talking with you about this is that they didn't give up. Because if you're an at-risk group, you have all these complications and you're used to a routine and you're used to a support system and everything else, and you don't have it anymore, at least it's not the way you did have it. They still didn't give up. And that's a reflection on what you guys, I think, and a part of it anyways, for sure, is what you guys have brought to them.
Yeah, they are a very resilient group.
But if that didn't come by just naturally, that's not, people aren't born with resilience.
Right.
I think you guys had a big part in creating that resilience and keeping them there, and not having them give up. Because many people did, you know, many people did, and you didn't lose anybody in those first 10 months. That's fantastic.
No, they all stayed healthy, did what they needed to do. You know, it was a struggle. It was hard for sure. But I think, you know, being able to talk, you know, at least once a month, and I know others reached out to their friends in the group, above and beyond support group meetings. But yeah, they are a amazing group. We always say we get more out of these meetings than they do. I mean, they really, it's a special group that we have, honestly.
I mean, looking at it from a scientific point of view, percentage wise, in the at-risk group that you had, you should have used, I mean, I could figure it out sometime later, but there had to be a number that would be expected that you would lose in that period of time.
Right.
You know, there had to be, given the number you've got, and given
all their risk factors.
Exactly.
Right.
It's not just luck.
Right.
You know, I mean, I think, I'm just talking out loud here, but I think that your group should look into that, or have someone look into that independently.
Yeah.
Because there's a reason why you didn't lose anybody. And it's not because of happenstance, or because they're all resilient, or because, you know, just because that's the luck of the draw. There's a reason why. And I think you guys had a big part of that reason. I'm not gonna say all of it, but you had a big part of it because of the culture you created before the pandemic.
Yeah, definitely.
That's my opinion.
That they had the tools to get through it.
Exactly. And you explained them the tools and they used it. And so all those preparations that you did for all those years with them, all the 13 years, how long have you been working with them?
8 years,
It worked.
Yeah. Right.
Yes, you were given the worst possible conditions you were given to you. And you succeeded. That's a big deal.
Thank you.
Okay, let's fast forward now to 2021. You know, now you got them, some are vaccinated, some are not. What did you see as far as the trend going into 21 then? In terms of the variants and so on and so forth. How did it affect them psychologically, and how did it affect them physically?
Yeah, you know, it was, it wasn't as difficult as the first year, but it was always, you know, every meeting we were just trying to find a way to get the group to be able to meet in person. Thought we'd be able to do it in the spring, didn't happen. Thought we'd be able to do it in the summer, of course, didn't happen because of all the variants. And I think that was hard. I mean, we kind of were hoping and really thought that we would be able to do something at least in September, where everyone could get together again, meet in person, and that unfortunately didn't happen. So it's going to be very interesting to see how 2022 goes, because we just have to keep folks engaged. You know, again, the hope is in the spring that we'll kind of be through the worst of this and be able to meet in person. But yeah, I think it's getting harder, I think. You know, the virtual thing was a blessing, but I think everyone's getting, you know, a little burned out of it. We've noticed some numbers drop a little bit toward that fourth quarter. So we're just going to have to find a way to rejuvenate the group here in 22 to keep them engaged so that we can get through these next couple months, hopefully, until we're able to be able to meet again in person.
What happens when a person with diabetes gets COVID, I have no idea how it affects them. So have you seen it happen personally? Do you know what happens? You've seen a patient with get COVID and survive or not survive?
Yeah, I think it's just that unfortunately in their bodies, there's already diabetes causes an inflammatory process to be going on. They probably have high cholesterol, they probably have hypertension. So it just puts them at much more risk of heart problems with the diabetes. Some of our folks do have some lung issues, COPD, asthma, things like that. That definitely, did not help with Delta, because that's sort of where that variant went to, was the lungs. But definitely it's a struggle getting their blood sugars under control. If the COVID turns into a bacterial infection, that's really stressful on their body. That makes the blood sugars really unpredictable. So it just puts them at much higher risk of complications from COVID, unfortunately.
Have you seen COVID patients in your group or groups?
I am on the COVID unit. If there are folks who have diabetes, who need education prior to discharge, then we do go up and see them. They're not necessarily support group folks, but just people in the hospital who have diabetes. They need something before they leave from the educator. So we have been on the COVID unit, not a lot, but here and there for sure.
How many a month, let's say? 5, 10, 2?
Yeah, probably 2. The docs, I think, try to not have us go up there, just, especially initially for exposure before we were all vaccinated, especially, just didn't want a lot of traffic on the COVID unit. So we would do some things over the phone, go into the rooms when we needed to, of course. If you have to, you have to. But I know in our census in the COVID unit we have 10 or less patients usually. So it's not like we're taking care of hundreds of COVID patients at a time. So it's a pretty small amount.
Did you lose any over the past year in the COVID unit?
Oh yeah. I don't know how many, because I'm not up there every day, but I know that there were definitely folks who unfortunately did not make it.
Well, it had to be tough.
Oh, definitely. I think the nursing staff, I'm sure, as Roland has said, was very difficult for them. It's been a long 2 years for the nurses. I did also work with some of the folks who were homeless, would come from the shelters and end up in the COVID unit. And then what happens? Where do they go for their quarantining? So there was actually an initiative with all the hospitals in the area to work with some of the other social service agencies to set those folks up in different hotels so that they could quarantine and not be going back to the shelters.
Yeah,
that's been going on for, oh boy, since COVID started. So that would have been since early 20, or in the fall of 20, we kind of started that process. So that was really great. All the hospitals were working together to identify folks who were homeless, needed quarantining at a hotel, and then getting them over there and, follow up and all those kind of things. So It was successful, I think.
I never thought about that, but you get a homeless shelter person with COVID, what are you going to do? You can't put them back.
What do? You can't put them back in the shelter because it's already a congregate living situation where COVID spread so quickly. So that was the way to do it. And, at that time it was like a 12-day quarantine. So it was, it wasn't 5 days like it is now. They needed somewhere to go for almost 2 weeks. Dependent. If they were in the hospital for a couple of days, we would take that off the total number of days. But still, it was 10 days, give or take, probably. So they were given a room, meals. There were nurses on site in case they needed something. So it was a good situation, I think, and all the hospitals worked together, which was wonderful to make that happen. So, and the county was very involved. So,
wow. So what have you seen, let's say it's from September till now, what have you seen as far as a trend? I mean, you've been observing this from the health perspective and from your own personal perspective in terms of, the people that you look at. What have you seen from, can you break it down into certain groups of time, certain blocks of time, or is it just, I mean, is there a way to look at different units of time? Is okay, back when this happened, we were acting like this. And then during this time, this was looking like this. I mean, there's a way to look at it in blocks of time.
Yeah, I guess those first, 6 months, it was just so much of the unknown. Just no one knew, there was no vaccine. There was, it was just shut down. I mean, I think everyone just kind of shut down.
How did you handle misinformation back then, by the way? Because that was rampant.
Yeah, and that was part of the vaccine discussion with support group, was like just all the misinformation and the pharmacists trying to kind of touch on that, like where was this information? Where did you hear that? Where is it coming from? And sort of dispelling some of those myths as to, there's just no basis for that thought. Like there's no studies, there's nothing that says that happens if you get the vaccine, or there was a lot of that. But oh my gosh, I mean, it was pretty rampant. Lots of misinformation that was out there about the vaccines, and there's just vaccine hesitancy in general.
Right.
I think in the neighborhood, that's been, that's not new. I think it was just accentuated by all of this.
I agree.
That people didn't really understand that phenomenon, and now they definitely get that more. But I mean, we still have some folks who have not gotten the vaccine.
When you have the data and the data, and let's just say your group, okay, so your group of, let's just make it 30 people, and suddenly they start getting the vaccine, and now they share their stories by saying it had no effect on me, or whatever. It had to really help convince the other people, because they're waiting for the horror story that never happened.
Right, definitely, because we had lots of folks who said, I got it, or and I wasn't sick, or someone, my coworker and I got it, and we were fine the first round. The second round, we did have a little, we didn't feel good for 24 hours, but that's not uncommon. So we tried to dispel some of that, yes, you might have a headache, you might feel this, and this, but it's going to last 24 hours, if that, and you're going to be fine. And it's worth 24 hours rather than, potentially 2 weeks in the hospital. So
exactly.
Yeah, definitely when folks talked about themselves or family members getting the vaccine, and very few honestly had side effects. It I think helped kind of move the needle for some of them. And then when they'd come for visits, I know that the educators definitely tried to talk to them about it if they noticed in their chart that they hadn't gotten the vaccine. Just ask, just some questions as to where the hesitancy was, and if there were any questions or anything that they could, shine a light on that would make them, feel more comfortable getting it.
What kind of pressure did the families have on them, or any at all? Because you're talking to the person who has this condition, and then they have a support group surrounding them. How do they feel that they may have been a burden to their families because they were to such an at-risk group, or do they feel anything about that at all, or anything like that, because they're such an at-risk group?
I know there definitely was concern with, the married couples or folks who had children at home. Some had adult children at home. But they really wanted to get the vaccine as soon as possible so that they didn't give it to that family member. That was a huge thing that we heard. And some folks had, family members who were able to get it maybe at their work or, through somewhere else. And then, we were trying to help them get the vaccine and because they didn't want to give it to anyone. And that was another piece of it for some that they really wanted to get vaccinated so that they didn't pass this along to anyone.
Right.
Not just for their own benefit, but really for their families.
Did you find anybody in your groups not believe the pandemic?
In our group, I would say not. No.
Let me share. That's why I asked that question, because you had such buy-in and because you had such concern, and I think also because you had 0 deaths, that they had to be a group of people, which is unusual, that everyone believed that the pandemic was real.
Yeah, I don't think we had any real unbelievers in what was going on, honestly.
Perhaps, and I'm just throwing this out there, okay? So it's not a scientific statement at all.
Mm-hmm.
But when you have an at-risk group, they tend to believe these things more than people who aren't.
Right.
So therefore, they take these things seriously because they know how much their health can be impacted.
Right.
Versus,
and they're much more focused on their health every day.
Exactly.
Mm-hmm.
Because to them, it's like, why not believe it? Because if I don't believe it and something happens to me, I'm screwed.
Right.
So I think that perhaps the at-risk groups, and I'm just throwing it out there because of your data, this is all brand new to me. The at-risk groups had much more acceptance of the reality of this than groups that weren't at risk.
Right. Oh yeah, I think that's totally valid.
Because they had 0 people comment that no one in your group said this is not real.
Fake. No.
That's unusual.
Honestly. Mm-mm.
Because in my conversations with people, you had at least 10% of the population, okay, and the average is about 20% of the population that they would come in contact with didn't believe it was real.
Didn't believe it, yeah. Okay.
And in your case, you have 0%.
No, yeah, there was no one. I mean, unless they didn't voice that,
but they would have. They would have.
I just feel like it's a pretty open group, and they are not shy. We know that from many years. They are not shy about speaking their mind or asking questions. And that it wasn't happening.
But they also, the fact that they're inundated with this every day. In the first 4 or 5 months, there was nothing on TV to distract you. It was just the news constant.
Right.
On this. There was nothing else that you had that you could focus on. And so for them not to push back on that means that they accepted it because of the risk factor. That's
definitely.
That's something I want to expand on with other groups that I talk to, because that's something that it makes sense to me.
Yeah.
But I never noticed it before.
Yeah, no, that's very interesting.
And to correlate, this may not be a correlation at all, but you had 0 deaths due to COVID from that group.
Mm-hmm.
That's so you have people who are at risk, who you're going to lose based upon percentages.
Yeah.
You had
hope not, but
right, but it's going to happen.
Risk.
Right, it's going to happen because that's what the data shows you. But you had 0, and you had 0 people who thought it was a hoax, and you had 100% of, well, not 100%, but you had a high percentage of people who were concerned about their health because of it. So I think what that shows is that you guys conveyed the seriousness to an at-risk group well enough not to scare them into making them give up. Remember, I asked the question, did anybody give up? But not to scare them into giving up, but at the same time, helping them be resilient through it. That's an amazing statistic. Wow.
Yeah, it's interesting.
Big time.
Very interesting.
I want to share that with Sister Miriam. Next time I send her an email, I want to talk to her about that, because that's something that they may want to consider investigating further.
Yeah, it is.
Because it's unusual. I don't know if it's common in that at-risk group to think that way. I have no idea.
Right, if anybody's done any research on that yet. Yep.
Pardon me. I have a little bit of bronchitis right now, so I'm taking
many
cough drops. It's
no.
okay.
It's going around.
I know. So back to the present day. So now let's fast forward to this past January. Did you notice anything from October until the end of the year in terms of people getting tired of it, people, still dealing with it, or fatigue or anything like that?
Yeah, definitely. I mean, there's fatigue, I'll say, especially going over to Skyline. I mean, people are just tired of the mask. So, that's gotten a little more lax. Certain things like that, I think people are just, getting a little tired of everything. So I have noticed that a little bit. And even, with the spike in November and December, I don't know. People are definitely not talking about it as much.
Okay.
I feel like they're kind of like, at least not over at Skyline Tower. It wasn't the first topic of discussion kind of thing. Whereas I would say, when we started going back, it definitely was. That was what everybody was talking about. Yeah, I think they're trying to get back to some semblance of normalcy.
So it goes into the background, but it's still there.
Yeah. I feel like they're just living with it.
You know
as
what?
all of us are, but
you know what? What if you've got a group of people who are used to living with a disease, that they just put this like in the pile of diseases?
Right.
Yeah. They know how to live with a disease.
Yep.
All their life.
Another thing on the list.
Just put it on the pile.
Right.
So they know how. That's something. So that could explain the resilience, Leslie.
Yep.
They know how to do this.
Yeah.
Diabetes is not something you get cured from in most cases.
No.
You have to constantly, right? You have to constantly check your health every day. So how do you deal with that every day? Well, you learn. You ask a person how to do it. Well, they learn how to adapt.
Right.
So with COVID, it's the same thing for them. We learn how to adapt with this. We learn how to adapt with that. It's not a big deal.
Right.
That would be a very interesting study. Let's think about this for a minute. And I don't want to go into details. But what if we compared, we did a 3-question survey on your group, diabetes only.
Yeah.
And then compared and had the same 3 questions answered by people who didn't have any kind of debilitating chronic disease.
Yep.
And see how the questions are compared to.
Are answered, right. Yep.
Because that's why they're used to it. They know how to do it. And they'd be a great group to learn from.
Yeah, that'd be very interesting.
Teach us how to deal with COVID. Because there's going to be, here's why I'm saying it, there's going to be people, a percentage of people in this country who will always have the effects of COVID. They'll live with it.
Right. Who may not have had, this type of chronic thing before.
Right. So now looking at support groups, you got plenty of people with diabetes in this country.
Oh, yeah.
They could be great support people for this new group of people who need it.
Right.
Just something to think about.
Yeah, definitely.
Okay, I want to keep you. So one more question. How would you, if you were to tell somebody, someone listen to this interview, when they would say, well, how was a pandemic to you? What would you want to convey to them?
Oh my gosh, there's so many different facets of it.
Answer it any way you want to answer. Answer all of them. Some of them I don't care.
Yeah. In some sense, it's brought to light some things that we probably wouldn't have considered, especially with support group and just their initial hesitancy with using the technology, lack of technology, lack of internet access. Like, we just never really delved into that. We weren't ever even emailing folks reminders about support group. It was all telephone calls. And after this started, we started emailing the link to the Zoom meeting to folks. So I think it's changed the way we communicate, or the way that we think about our support group participants. I think we had this idea that, oh, they don't have computers, they don't know how to use them, that we're not even going to go down that road. And this forced us to. We had no options. This was the only way to communicate with folks and potentially have meetings. So definitely opened our eyes to those situations.
That's an interesting point, because you have people, let's say you're sitting in a meeting of administrators, all right? And one administrator says, why don't we get them all on email lists? And someone says, there's no way they're going to do that. They don't even have, they don't know how to use this.
Yep.
So it was always discounted because of the age group.
Yep.
Well, now you've just proven, based upon your skill set and what you guys do, that this group can adapt.
Oh, yeah.
To 21st century technology.
And they want to.
Yeah.
Like, we offered digital literacy classes and they wanted to come to class.
Wow.
They wanted to learn how to use the computer. They want to know how to email and look things up and, you know, do all those things. And for some of them, there really wasn't that apprehension. I mean, they were full steam ahead. They wanted to do it all, come to class, learn all of these things. And yeah, I just don't think that the access to that training is accessible enough, because they needed rides to get to the training. And I mean, there were lots of barriers to getting them there, and we worked through a lot of those. But I think there's lots more folks who would take advantage of it if they had some of those barriers removed.
I would love to join your Zoom meeting one time, just to ask some of these questions and try to give them my observation and congratulate them on what they did.
Oh, they would love that. They would love that,
because
for sure.
I'm telling you, there's papers that you can be publishing based upon what they've accomplished.
Yeah, yeah. Our next, so January we have a set topic, but our February meeting is the 24th.
Please count me in.
Yeah, I definitely will. I'll send you the Zoom link.
And I'd love to be able to interview one of them.
Yeah, okay.
You pick one or pick two.
Okay.
And then I'll do the same. I'll interview them, but I'd love to have their viewpoint, because I'm observing them through you.
Right.
But I would love to have their viewpoint on this. I think it'd be fantastic to have that.
Yeah, definitely. So I can reach out to you know, we'll
you pick it, whoever you want. Yeah,
yep,
you pick.
Yep. Perfect. And then I'll have to provide them with your information, and
That's
then
fine.
they could reach out to you.
Yeah,
just
do it that way.
for
That's
you know,
fine.
just for,
I know.
because I can't give out patient information. So
I know.
yeah, but then yeah, if they, you know, reach out, and I'm sure they will, I'll just explain to them what it is, and yeah, that they'd be more than happy to.
I'd like to be a part of that Zoom meeting though in February. Just for 5 minutes, that's it.
Definitely.
And here's the reason why I'm saying it. Because I've talked to many people over the past year on this topic. This is the first group of people that I've been referenced to that have had this kind of success and this kind of acceptance and this kind of resilience. It's never happened to people, and I've talked to hundreds of people.
Wow.
But I've never seen this. That's why it's so astonishing to me. Yeah. So I want them to know that they are a special group because of that.
Right.
So, okay, you set that up and I'll be there.
Yep. Perfect.
Excellent. Okay. Anything else you want to add, Leslie?
No, I thank you for the analysis of the answers, because it's been very enlightening. So thank you.
Certainly. I look forward to, well, I'll let you know as we progress through.
Okay.
You know, I'll put this on my recording, and I'm recording it to the cloud. But I got 3 schools involved right now that are doing the artwork, and they're going to start the artwork in about a week.
Wonderful.
So we have all different types of occupations, all different types of people involved. So when you're looking at the exhibit, you know, let's look at the gallery. And I'll send you some videos of what we did before. In the last thing we did is that you have so many different, when you have so many different artists, first of all, and I'm not an artist, okay? I'm a chemistry teacher. But when you have so many different artists, usually a gallery exhibit is one artist, okay? And you never know. I mean, I don't interpret art very well. So when I go to an art gallery, I'm going like, I don't have no idea what it's supposed to be. And of course, the artist never tells you what's supposed to be. You're supposed to figure it out yourself. I'm like,
figure it out.
Yeah,
Right.
Please help me. Okay.
Yep.
But in this case, what I did was I had the art in the middle, and on the right side, I had the artists, who they're from, and so on and so forth. On the left side, I had the first responder or the person I interviewed. And then below that, I had a quote from the interview. So you're looking at the art, you get a chance then to see what inspired it, who the person was, and what their role was.
Interesting.
So when people went through the gallery, and I had over 400 people go through the gallery opening back in November, and I told them what they were looking at, they're all like going, oh my God, really, that's, oh, holy cow, thank you so much. They were actually, I felt better educating them on what they saw. And because you had so many different artists, so many different stories, you had such a wide variety of artwork versus just the same person through his blue period or through the red period or through whatever period they had, you know, that most galleries that you have. So that's why this would be the same thing. And so I'm looking at May to have the grand unveiling of your piece, and then you get to keep the piece and take it home with you.
Wow, that's awesome. Thank you.
So when your grandchildren say, how bad was the pandemic?
Right.
You could say it looked like this.
Oh yeah. Oh my goodness.
So,
yeah.
okay. Leslie, thanks so much. I look forward to the email.
Thank you. Yes.
For the February meeting. I really appreciate that opportunity.
Yeah, of course. Thank you for the time today.
And thank you so much for your input. I really, really appreciate it. We shall talk soon.
No problem. Sounds good. Have a good evening.
Thanks so much.
Okay.
Bye-bye.
Bye-bye.